Good afternoon, ladies and gentlemen. My name is Amanda Gorlucky, and today for my persuasive speech, I have decided to do breast cancer and what that entails. For my information, I went to www.cancer.org along with www.breastcancer.org, and unfortunately, I do not remember the third source that I used. Breast cancer is when the cells begin to grow out of control. Cells in nearly any body part can become cancerous. Here's a picture of what the normal breast would entail. Breast cancer can be separated into different types based on the way it looks underneath the microscope. Most breast cancers are carcinomas, a type of cancer that starts in the cell of the body. Breast cancer is also a type of carcinoma called angiocarcinoma, which starts in the tissue around the glands. About 1 in 8, which is 12% of women in the U.S., will develop invasive breast cancer. 231,840 new cases of invasive breast cancer will be diagnosed in this year alone. A risk factors is anything that affects your chance of getting the disease. Age, race, environment, personal behavior such as smoking and drinking can cause breast cancer. There's a 5 to 10% chance of cancer that is caused due to hereditary. So your mother, your sisters, your daughters are at a risk if there's one other female in your family that has breast cancer. My sister-in-law and all 3 of my nieces are at a risk of breast cancer due to my mother-in-law having stage 4 breast cancer in 2011. It also can be hereditary to the men in the family, my husband, my son, my stepson, and any nephews I may have in the future. Women who have had menstrual cycles before the age of 12 or went through menopause later than the age of 55 are at a higher risk of getting breast cancer, which is kind of the terrifying thing to think about because nowadays in society, because of hormones and so forth in foods, it's causing young women to start their menstrual cycles early. My daughter alone was 10 when she started her menstrual cycle. So now, because of this one reason, she's at a higher risk of becoming a breast cancer person. There is no known cause for breast cancer. Just like any other cancer, there's not any one test that can determine what causes breast cancer, or any type of cancer for that matter. Screenings can help with breast cancer. They tell you at certain ages to start doing self-exams, and they give you walk-by-walk instructions on how to do this. Your obstetrician and gynecologist can do this. Your normal family doctor can do this. Any medical professional can give you these instructions. It is also recommended that women get mammograms yearly once they hit a certain age in life. The most common symptom for breast cancer is when you find a lump or a mass, something that doesn't feel right. It's a painless, hard mass that has irregular edges. It's how they describe it. So when you're feeling around, if you feel something that is not normal, it feels kind of edgy, they tell you to go contact your physician automatically. Other symptoms of breast cancer can include swelling of all of your breast or just parts of it, skin irritations, dimpling in the skin, your breast or your nipples becoming very painful, your nipple retracting, going inwards instead of poking outwards like it would normally look. It could be red, it could be scaly looking. The area around the nipple could become thick and hard. They also say nipple discharge that is not common with what a milk discharge would look like is a symptom. There are 5 stages of breast cancer survival rate. The first stage, the first 2 stages, 0 and 1, you have a 100% chance of survival. At stage 2, there is a 93% chance. At stage 3, you have a 72% chance of survival, and by stage 4, you only have a 22% stage of survival. There are several different treatments that women can go through. There is surgery where you have partial or your whole breast removed, one or both at this point. There's radiation, chemotherapy, hormone treatments, there is targeted treatments, and there is bone directed treatments that can be done. Stage 1 breast cancer, or any cancer for this matter, is when the cancer is still small and has not spread to other parts of the body. Stage 2, the cancer site has become larger than stage 1, but it has only spread to a few lymph nodes in the body. Stage 3, the tumor has become really large, 5 centimeters or 2 inches across. By stage 4, the area is still considered quite large because it never does shrink, and it has spread beyond the breast and lymph nodes and to other parts of the body, your lungs, your stomach, other areas in that general area. When breast cancer comes back, it is called a recurrence. There is a local recurrence, which is when you get cancer in the same spot as originally. A regional recurrence is when it comes back, but it's not in the original location, it is somewhere close by. Or a distance recurrence, which is in another location. You can start out with breast cancer and then you can get cancer in your lungs. That is what they consider a distance reoccurrence. Cancer survivors can also be affected by a number of health problems, but they are at a higher risk for getting cancer again. Most cancer patients will stay in remission for a year, 2 years, or even longer before they ever have it again. But there is a high risk that they will always get cancer a second time around, if not more. And eventually, it can spread so fast that it will become stage 4 and they will only have a 22% survival rate. For me, this topic was very personal because when I started in the healthcare field, I worked with an older woman who had lung cancer. By the time she lost her life due to her lung cancer, she was so sick and fragile that it devastated me. In 2010, when my husband and I started dating, his mother had just found out a couple months later that she had cancer, breast cancer of all things. She did not let anybody know what stage she was at. She just told us that they were doing treatment and everything would be okay. When she passed in November of 2011, we found out that she was originally diagnosed with stage 4 breast cancer, and even after the mastectomies, it had spread so fast that there was nothing they could do to prevent her from dying of this. It was very painful and very hard for us to watch her go through all this treatment and other factors that she had to deal with because there was nothing we could do to ease anything. I recommend that women at an early age, even before the recommended age, of start doing self-exams. My children are 10 and 12, and I have already started, teaching them about, doing their own self-breast exams, if they feel something that doesn't feel exactly right. I remind my mother, since she is now in her 50s, it's time again to have that mammogram. So my suggestion to everybody is please check yourself, check your daughters, your nieces, remind your aunts, your grandmothers, and every woman in your life, your friends, to please have this done. I want to thank you for your time, and I apologize this is almost 10 minutes long, but please, for the sake of yourself and your family, please get tested. Thank you, and have a great day.